there. And here is our patient who's not feeling entirely well today. Are you? I shouldn't feel bad about it. I shouldn't worry about it whatsoever. I'm here. I'm going to give you a full checkup and make sure that I'll give you the right medicine to get you back on your feet as quickly as possible, and hopefully give you something, whatever is needed for today, to help you sleep a little bit better. I really am happy that you thought to call me up and see if I would come over and do a checkup in your bedroom. It's a lovely bedroom, by the way. It looks really nice. And honestly, don't worry. No one looks their best when they feel unwell. You just look exceptionally good still. That's the problem there, that I don't have that luxury. Yeah, well, it's a really nice bedroom you've got here. It's perfect for trying to feel a little bit better. And thank you so much for getting comfortable in that chair there. You sure you're comfortable there? I mean, you're more than welcome to go onto your bed and lie down, and I could still do the examination there if you wish. That's perfectly fine. It's all dependent on how you're feeling right now. Okay, so I've got everything in here that I can use to give you a full checkup and make sure you're feeling great. Okay? Right, so please don't feel like it's necessary to move around or anything. I'm simply here to help you, check over you, and hopefully make you feel better. Then I'll be out and you can get back to resting and having a great sleep afterwards, I hope. Okay? Good. I'm glad that's good. So don't overexert yourself at all. I'm here and I can do everything that I need to. You don't need to do a thing, okay? Excellent. Thank you. Is it alright if I just place my suitcase here just on your table there? Is that okay? Thank you. It's just got all the doctor things in there which I need just to give you the full checkup, okay? Well, I'll open it here for you. Okay. It's just the standard doctor things. That way you know what I have in here. So it's basically everything that you've probably seen in the surgery. You've got all the stethoscopes and otoscopes and everything we need just to give you a full check-over. Okay, so all things, and if need be, I can write you a prescription at the end here as well, and it can be anything. I think I already know what you've got at the moment. Yeah, it's in your voice. I could see it around your eyes. They're feeling a little bit sore. Yeah. Okay, don't worry, I can give you the full check, and now I can make sure different things in here. I've got tuning forks that we can use, and various other instruments which will be instrumental to making sure that I can diagnose properly what you've got at the moment. Well, I don't think it's a bacterial thing, but I'll just pop this over here and we can get started if that's okay. Thank you so much. And would it be okay if I just take my jacket off and just place it over here? Thank you so much. It's a little bit toasty in here. I know now you've got it a little bit warmer. It's what happens when you don't feel so good. So I'm just going to check the top of your forehead here. Okay, I'm just going to rest my hand there. Ooh, yeah. It's quite hot, isn't it? Yeah. Bit of a temperature there. Bit of a fever by the feel of it. Okay, not what we want, but not incurable. Right. Well, how long have you not been feeling your best? When did it start? About 3 days ago. 2 to 3 days. 3 days when you started feeling a little bit like you'd lost your energy. Okay. I'm just going to check your heartbeat, that's okay. Yep. And it got a bit worse. Did the cold follow? Okay, I'm just going to place this in. The cold followed in short order. best quality of sleep. Well, unfortunately, that tends to happen a little bit when you've got a bit of a cold like you appear to have. So what I'm going to do, I'm just going to place this on your chest. What I'd like you to do is just take some very deep breaths with me, but I'll guide you through that, okay? So I'm just going to place that top of your chest there. Okay, if you can just breathe in for me and out through the mouth. Thank you. And again, we're going to do that again if that's okay. Breathe in and out through the mouth. Okay, and I'm just breathing normally. So I'm just, yeah, that's great. You're doing great. That's fine. I'm just feeling around your body here. I'm sorry, it's a little bit cold. Okay. Well, yeah, I'm just checking that we haven't got signs of infection anywhere, which you don't. It sounds like just quite a lot of mucus build-up, which tends to be the case with nasty cold. Yeah. Okay. That's sounding pretty normal to me, and yeah, probably not too comfortable for you. All right. So if you don't mind, I'm just going to get my otoscope here. Now I'm just going to gently press this in your ear, just so I can get a better indication when I look down your ear canal. See if there's a build-up of earwax, and if that's causing you any bother. When you have bad cold, flu or something, then your sinuses can all be heightened, and it can also cause a little bit of discomfort in your sinuses and make it feel blocked. So if it is, then of course I can probably help you a little bit of that as well, but we're just checking for now. Okay, I'm just going to turn this on, and if you can just keep nice and still with me there. Thank you so much. Thank you. So I'm gently just placing that in your ear. This shouldn't hurt at all. Sometimes when you've got a bad cold, the flu or something, you can feel very tender around your ears. So do you feel any tenderness here? Okay, what about here? Okay, do you feel any tenderness there? Okay, and what about there? Do you feel any tenderness there? No? Do you feel any tenderness here and there? No? Good. Right, I'm just going to have a nice look in there. Alright, yeah, okay. And I'm just going to go in your right ear now. I'm just same again, this shouldn't hurt whatsoever. If you feel any tenderness, just let me know. So I'm going to place that there. Okay, you feel that there. Just have a look in there. Does that feel tender around here? No. What about here? Does that feel tender at all? No. And what about here? Or there? How's that? No. Okay. And does that feel a bit tender? Okay. Does that feel a bit tender there or there? No, that's great. So just looking down your ear canal here. Yeah. Alright. Alright. That's as expected, really. So you have a bit of a build-up of earwax there. And so what I'm going to ask you to do, if you can just open your mouth for me shortly. I'm just going to check your tongue, check in your mouth, check your tonsils, and just give you all-round good check in your mouth, okay? Because everything, sinuses, your mouth, it's all going to be linked up, especially when you've got a cold. It's you don't want the full package, so hopefully you haven't. Right. So I'm just going to put my gloves on here. Apparently these are large gloves, you can afford me, but there we go. Excellent. Right. place this in your mouth, okay? And I'm going to ask you to open your mouth in a minute as widely as possible, and just place your tongue out for me as wide as you can. I know it's probably not going to feel the best, just because you're obviously a little bit sore and bunged up a little bit, but don't you worry about it. You just do as much as you can manage for now, okay? Do you want some water or something? I notice you got some by the side of the bed here, which is what I'd like to see. No? Okay. Well, one important thing, keep drinking plenty of fluids. That really help, okay? So if you can just open your mouth for me, I'll get my torch here, and I'm going to have a good look in your mouth, okay? So I'm just going to put the torch there. There we go. Right. So if you can just open your mouth. Thank you. Open. I'm just going to place this in your mouth for me. Okay, just over your tongue. That's right. I'm just going to have a little examination in there. A little examination. Right. Yeah, you're doing really good. Really good. Yeah. Okay. I'm just going to take it out. One moment there. Give you a chance to breathe. I know you're a bit blocked up. I mean, one of the last things you probably need right now is a doctor having a look around and not making things any better immediately right now. Okay, so if you're ready, just open your mouth there for me. That's great, thank you so much. I'm just going to place that on your tongue there. Again, just get the torch and look in your mouth there. Okay, and just so it's not so bright in your eyes there. Right, okay, yeah. So it does look like it's very, very mucousy in there. Doesn't really show signs of swelling in your tonsils, but it does look sore, which is a classic symptom of a nasty cold there. Yeah. It's not causing you any discomfort anywhere. Okay, no. But apart from that, everything is looking good. It's just the mucus build up there, which can be expected with a cold. It's a cold like yours for sure. Okay, so that's all looking fine there, all things considering. Okay. I'm just going to ask you if I can take a look in your eyes now individually. I know already they're looking quite sore there, and that's a common thing when you've got a cold or not feeling very well. Your eyes always get a little bit red and a bit more heavy looking. Yeah, and it's all your sinuses. It's all interlocked and intertwined with one another. So I'm just going to look in your eyes. Just going to put my finger just under your eyelids here. All I'm going to do is just very gently pull down the skin there, just so I can look in your eyes fully, and just under the lids here, and just make sure there's plenty of fluids there, because sometimes you can have a little bit of dryness there when you're blowing your nose all the time, or just generally with a normal cold. So if you need some drips or something, then I can give you a couple of those as well, just to help soothe a little bit more. Okay, right. So I'm just gonna turn this on now. Hope you don't mind. I've got my fish and chip breath here. Okay, I'm just gonna come a little bit closer now. I'm just gonna have a little look in your eyes here, in your left eye. Right, that's good. Yep. Okay. Right. Yeah. All the classic symptoms of a cold that I'm seeing right now. Yeah. Just a bit red, but as long as it's not feeling dry there for you. Yeah. Okay. Now I'm just going to very gently, like I said, just place my hand here. I'm just going to pull the skin down just a little bit there, a little bit there, a little bit there. Okay. Sorry for the light. I'm sorry for the light. in your other eye. Yeah, okay, so apologies once again for the beer battered cod. Okay, I'm just gonna get a breath. I'm just gonna get a little bit closer here. Right. Yep. Okay, it looks very similar to your left eye, surprisingly, but I mean, because of the symptoms, it's a little bit sore, isn't it? Yeah, a little bit watery. Okay. Yeah, and what I'm going to do is just very gently use my hand and just guide your skin down just a little bit onto your eye lid there. Okay, just a little bit there, a little bit there. Just have a quick look. Okay. Thank you so much. You've done really well so far. I'm so sorry that I have to come close and prod around and inspect everywhere. It's probably the last thing you need right now, but it's all hopefully to help you feel better as quickly as possible. Alright, so both your eyes, they're a little bit red. They don't look dry. In fact, quite the contrary. There's quite the watery eyes there, which this is more so common cold. What I'm seeing so far, I could tell you already it's a common cold. Just so we can put your mind at ease, so you don't have to worry about anything. And if you've got infection or need antibiotics, I can tell already that you're not at that point with this particular cold. With your breathing as well, it's like I said, it was mucousy. And if you could tell me what was the colour of your mucus when, I know it's not the questions you want, but I wouldn't be doing my job as a doctor if I didn't ask. Was it a little bit on the brown side? Was it a little bit on the green side? A bit whiter? No, that's fine. That's just backing up what I already know. Thank you. Right. So, I'm just going to check that everything is okay with your vision. I'm so sorry that we've got another light here, but this would be quick. And I'm just going to ask you very quickly just to look at this light when I turn it on. I'll tell you when I turn it on. And all I'm going to do is just cover it up. You don't need to follow it around. It's not an eye examination. Just going to cover it up and see how your pupils expand and contract. Okay, just make sure that's not causing you any bother there, because light sensitivity comes with colds, and depending on the severity of the cold, it can obviously make things take a little bit longer. Okay, so I'm going to turn it on here. Thank you. So if you can just look here, and I'm going to cover it up with this finger here. All right. Okay, and just going to get a bit closer here. Cover it up. Open. Cover it up. Just look at the tip here. Thank you so much. Cover it up. Open. Cover it up. Open. Cover it up. Open. Yeah, that's great. Okay, and just one look there, one look there. Okay. Thank you so much. You're doing really amazing. You're such an ideal patient. You have no idea how well you're doing right now. You're the idyllic patient, and in your condition of not feeling too good and dealing with this unwanted cold, you're doing exceptional. Okay, all right. So with your hearing, one thing I'd like to check once I've checked your ear canals, obviously there's the sort of normal build-up of earwax a little bit more when you feel a little bit bunged up. What I can offer you is just a gentle drop of olive oil. It's like olive oil, but it's obviously for your ears. It's just to loosen the earwax a little bit, so it will just naturally loosen everything up and hope just make sure that everything is clear and open for you. Yeah, great, we can do that. So what I'm going to do, I'm just going to use the tuning forks, okay, a couple of tuning fork tests, and then we're going to do a before and after, and hopefully there's a little bit more clarity, okay, and then you know the drops have done its job. Thank you. just going to make some very soft sounds with this tuning fork, okay? Is that alright? Thank you. Okay, I'll do the same again. Okay. And right. So did you have any difference when you were listening to those tuning forks? Was it a little bit clearer on one side than the other? It's a little bit clearer on your left. Yeah, and you feel a little bit more blocked up. Yeah, that's just the nature of the cold, unfortunately. Okay, so I'm gonna prepare a drop for you here. So don't you worry about this. It's not a real syringe, like a, not one. So all I'm gonna need is the tiniest amount, but I'll put plenty in there just so there's plenty of solution. And what I'll do is just gently place this little nib here into that much of your ear. You shouldn't feel any discomfort whatsoever. And then all I'm going to do is basically one drop like that. So did you see that move? That's basically how much is going to be inserted in your ear and how much is going to come out. Right, okay, so I'm just going to get the solution here. Okay. Right, so it's pretty clear, as you can see. Okay, and then what I'm going to do, I'm going to do this with your right ear. So what I'm going to do is just gently place this on your ear. Right, so you're going to feel it just a little bit there, and all I'm going to do is just the tiniest drop. You might feel a couple of drops and feel it sort of running a little bit there. That's all we need. Simple as that. That is all that is needed. See, you basically don't see any difference here because it's just minuscule amount that you place in there. Okay, so I'm just going to place this in there. Okay, and just gently, gently, gently. Right, and a little bit. There's one little drop, and put a second drop there. There. See, and basically you can't even tell that there's anything in there, so that will naturally fall out. It just make sure that that's going to be nice and clear there for you. Alright, so we haven't had any issues with balance or anything like that. That can be quite common with colds. No, that's good. That probably if your cold was a worse cold than what I'm seeing right now. Okay, normally at this sort of stage you said about 3 days. Has it got worse, or is it sort of stabilized? It hasn't got worse since yesterday yet, so what I would say is that it's definitely in the stabilizing phase right now, and it's probably not going to get any worse. The thing is with colds, they're just an absolute nuisance. So to make sure that you get a good night's sleep, so hopefully that will help your ears a bit there. Yeah, just making sure there's nothing coming out of your ears there. I want to make sure it stays in for a little while at least. Right. Okay. So, how are you feeling now? Yeah. Well, we seem to have gone through quite a lot of things here. So, just one more thing. I'm wondering if I can just take your blood pressure. It's just so I know. I mean, it's going to be as expected. Okay. I've got a handheld one here. I know that patients tend to prefer this method, okay, the old-fashioned way, which is completely understandable. So I know I'm just going to ask you to move your left arm there. Thank you so much for sitting in the chair. I know it's probably not comfortable for you at all. Okay. So if you want to place your hand there, that's right, you just keep nice and still there for me, and I can do everything I need to here. Alright? Thank you. Alright. Okay. Yeah, perfectly fine. Perfectly fine. And even more impressive that you've got a cold and it's perfectly fine. So. Well, now, I think I know exactly how to help you here, and what's going to improve your situation at the moment. Now, okay, you ready for it? Okay, so Dr. Prognosis here. My diagnosis is you've got a cold. It's not a very nice cold, and it's just one of those really annoying ones which hinders your sleep, and it's not going to let you sleep very well. So I've got a couple of things here which I could recommend, and hopefully something that's going to help. But there's no infection, which is really good to see. And you seem to be functioning perfectly fine. Your breathing is fine, blood pressure's all good, and everything else seems pretty normal. So definitely a cold. I mean, I knew it as soon as you walked in. And colds can feel very draining, shall we say, and just a pain. So what I'm going to ask you to do, and if you can do it for me, is I want you to have the very best night's sleep possible. Easier said than done, isn't it? Yes, but what I would like you to do is get as much rest as possible. So, do you ever hit your 8 hours sleep target? 8 hours of work, 8 hours of play, 8 hours of sleep? You hit the 4. Okay, well, in order to shift this cold and throw it out the window, you're probably going to need a little bit more. So if you can aim between 6 and 7 hours, that would be a start, and rest throughout the day. Don't overexert yourself. You need some you time, and if you do that, then it'll work in favour for your cold, and you'll be saying goodbye to it as quickly as possible. Okay, right, so what I'm going to suggest here, when you feel up to it, so I'm just going to write down one solution which I have. This is over the counter, but it's not a prescribed medicine. But I'm just going to write it in here anyway, because I don't have any other paper. So what you're going to be looking for, write it down here. It's a bit of a mouthful. This one. Okay. So if you just take this to the counter, and I think you can get it at supermarket pharmacies as well. Ask for that, and they'll give you a bottle of it. What I'd like you to do, this is basically at the end of your cold. If you can take this solution twice a day, morning, night, you only need, it's a liquid formulation, and all you need is 2 small spoonfuls, okay, with each serving. Okay, and once you've had that, that will get rid of the lingering remnants of your cold. Okay. Right. So I'm going to give that to you here. I don't expect you to take it. I'm going to place it on your table there. Alright, so it's there when you need it. So what I have here for patients with colds, at least, I have a very nice relaxing, it's like a spearmint minty tea tree scent. I've got it on some sprays now. These can go onto your eyes like so, and it can be very relaxing, but with your eyes closed, of course. But what I'm going to do is just mist up around you here, and think of it as a bit of aromatherapy, and hopefully this will just help you feel a little bit better. Alright. Okay. So I'm just going to turn that on there. Alright. Just going to turn this on here. Okay. Now, if you can just take nice deep breaths for me. Breathe in. I know it's a little bit blocked, don't worry about it. You're doing a great job. And out. Okay, bring it over here. Just breathe in. Okay, this is to help you relax and definitely make sure you don't get anything extra like a unwanted headache because you're not breathing through your nose properly. Yeah, so hopefully this will really help you fall asleep a little bit better. Right. Just a little bit better. Fall asleep for sure. That's exactly what you want to feel. A little bit better, bit by bit. Okay. It appears that you've fallen asleep. That's really good. Okay. Well, I think my job here is done, so if you could hear me, I'm just going to let myself out. Thank you for being an amazing patient today. I hope you're going to feel better quickly as possible. As quickly as possible. And get a good night's sleep. You're snoring now. Okay. lots of water. You'll feel a lot better. Hope you feel better. Take care of yourself.